Well, right now it's possible to add genes to humans. Blind people are seeing again, but it's only small. It's thousands of people. It's not millions yet, but we are getting better at it. And eventually, probably certainly in this decade, we'll see people being able to add genes to their bodies more commonly. But CRISPR is different. CRISPR is not adding genes. It's actually changing your genetic makeup permanently. And so where we're at is there are some genes or some studies that have shown that it works in humans. You can correct sickle cell anemia and fix that. That one's a little easier because it's in the bloodstream. Trying to fix Alzheimer's with CRISPR is going to be a lot more challenging. The blood is easy to access. And the way we do it is we put a CRISPR system, which is an enzyme that you can direct to change the DNA with a barcode. So our DNA has different letters. There's 6 feet of this DNA molecule in every cell. And there are these 4 letters, A, C, T, G, and they're in different sequence. And what CRISPR does that's kind of incredible, if you think about it, is that you can give it a code that says, go find the sequence that's A, T, G, C, A, G, C. And it'll find it in billions of combinations in that 6 foot and go in and just change that. It's a barcode. And so I would say in the next 5 years, it'll be fairly common to fix genetic diseases with CRISPR. And then things get really interesting when we start to fix things that aren't genetic. Maybe we want to all fix our predisposition to diabetes. We could potentially go in and fix that before we actually get that disease and make up for not having great genetic. Well, probably for the healthy people, it's going to take longer, right? Doctors would rather do no harm than do good. And so that's probably 15 years away from being mainstream. There are other technologies, one called siRNA, which is similar, but it actually stops the production of protein rather than changing the genes, one step down. And that's being shown, and there's a drug on the market to treat high cholesterol. And even there's a drug for fatty liver. And so increasingly we're able to change the genetic code or the codes that are coming off the genetic code, which is RNA, which we all have heard about because of COVID. It's amazing that we can now read the DNA and rewrite it. And in my work, we've just recently figured out how to turn on 3 embryonic genes in the body. And when we do that, just the right 3 genes, that resets the age of the tissue and it gets rejuvenated. Well, there are patients already that have had it done, but for it to be mainstream, 5 to 15, depending on the disease.